Welcome to the first of many lectures about neuro and neuromuscular disorders. This initial lecture is going to be about what can go wrong. When we discuss what can go wrong, I'm going to go through the various structures that comprise the neurologic system, beginning with the head. So on the scalp, what can go wrong here? Well, kids fall and they hit their head and it bleeds. So they have a little bit of trauma strictly from the fall. Now, depending how far they fall, they can also go a little bit deeper, and now it's affecting the skull. As you know, the skull protects the brain. It's nice and hard. The sutures and the fontanelles are actually open at birth. Posterior fontanelle and the sutures close in the first few months, and typically the posterior is closed by that third month, while the anterior closes by 18 months. So what can happen with the skull? The kid falls, hits their head, and they can have a skull fracture, or it can be intentional trauma. It can be non-intentional trauma, such as a motor vehicle accident, pedestrian versus auto. The child can also be born with a disorder called craniostenosis or craniosynostosis, and I have a separate lecture about that. And there's a wide variety of craniofacial abnormalities where this child's face and head did not develop normally in utero. We can have some neurologic behavior disorders. So the neurologic disorders are going to be on the left side, and the common ones are going to be hydrocephalus. When you were growing up, it was probably called fluid on the brain, but it causes increase intracranial pressure. Meningitis, bacterial versus viral, also causes increased intracranial pressure, and if not treated appropriately, can have lasting effects on the child. The same with encephalitis. We have a variety of head traumas that can occur because kids are kids. And then parents are parents, or caregivers are caregivers, and they don't pay attention, and the kid ends up hurting themselves. Seizure disorders are interesting because some of them are simply the wiring goes crazy. That's a really easy way to think about seizures. There's a misconnect between the synapses of the nerves. A child can have an innate seizure disorder, meaning we don't really know what caused it, they just have it. And then there can be trauma to the brain in the form of hypoxic ischemic encephalopathy, some type of physical trauma, gunshot wounds, severe head injuries, even a severe meningitis that can cause such damage to the brain that the child ends up developing a seizure disorder. Cerebral palsy, there's a separate lecture about this, but that generally results from an anoxic event to the brain that causes spasticity in the muscles and nerve endings. On the right side of the slide, we have our congenital or developmental anomalies. There's a separate lecture about neurotube defects, and the neurotube closes very early in prenatal gestation. If it doesn't close completely, the head can be open, the spine can be open, or the belly wall can be open. For autism disorder, we have our attention deficit disorders. These include Down syndrome, and then we have Fragile X. Nursing diagnoses associated with neurodisorders are here, and as we go through all of the different slides, you'll be able to take these diagnoses and place them in the various disorders where they belong. And I'm going to leave that up to you because now you should be able to do that. Getting back to the anatomy, cranial structures. Within the cranial structures, we have the meninges. What can go wrong here? If the child falls and has a little bleed, they can have a subdural hematoma. We already mentioned meningitis, which is a bacterial invasion. And then, believe it or not, children can have a subarachnoid hemorrhage. They can have a venous malformation, arteriovenous malformation, and with a certain amount of pressure, they can rupture and there's a bleed. Within the brain, we have our cortex, and you know that that's responsible for thinking, reasoning, our sense of perception, our ability to see and hear and taste and smell, the ability to speak and then have language that is meaningful. And you can see that it's in all aspects of the brain. Within the brain, of course, we have the endocrine functions, thermoregulation, how our moods are, our emotions, as well as our sense of thirst. And then our cerebellum is responsible for our balance and coordination. So what can go wrong? There's a lot. Anytime that there's cerebral edema, it can put a significant amount of pressure on the brainstem, which is responsible for having us breathe, as well as our level of consciousness, and it can affect it. There can be a hypoxic event. There can be brain damage from trauma. There can be cerebral palsy as a result of a hypoxic event. Malformations can just cause the brain not to develop normally, where it doesn't have any of the folds. The child's brain is smooth, and it's a very unusual thing to look at on an X-ray or an MRI. Tumors can develop. A cyst can develop. Abscess, so an infection from a tooth or from a sinus can develop an abscess within the brain. And then there can be alteration in the chemical and the endocrine problems. And this should just be a review of the different structures that are inside the cranium. It's pretty busy in there. And when you see the ventricles, that's another thing that can go wrong. We can end up with communicating or non-communicating hydrocephalus, where the ventricles are not allowing the fluid that bathes the brain and the spinal column to be absorbed appropriately or to connect with one another. Therefore, it increases intracranial pressure. When we look at the blood flow to the brain, we have what we call the cerebral perfusion pressure. And the equation for calculating this is the mean arterial pressure minus the intracranial pressure. We need to keep a certain cerebral blood volume to promote venous drainage. We also have an autoregulation mechanism where the blood vessels dilate and constrict based on the response to oxygen and CO2. So adjustments of the blood flow are made to compensate for hypoxia, and this is a protective mechanism so that the brain does not become injured. So that's why we always say that when a child is in shock, our body decides to perfuse the vital organs, and the brain is one of the most vital organs that it's trying to protect. When you look at your cerebral blood flow, remember the blood-brain barrier. This is a protective mechanism so that toxins cannot get through to the brain and cause permanent injury. And if you recall from week 1, this barrier is not mature until the age of 2 years. And so infections can set in and they go right through the brain. And that's one of the reasons that certain types of meningitis is worse in our very young kids. So pathology that can happen from the vasculature in the brain, an intracerebral bleed, intraventricular hemorrhage, which is very common in our preterm babies, AV malformations, and stroke. Our sickle cell kids can end up having strokes and also our AV malformations. If we have a decrease in the cerebral perfusion pressure, it can lead to brain cell death. And then we end up having permanent harm. Doesn't necessarily mean the child dies, it means the brain dies, and it alters their quality of life for the rest of the time they remain on Earth. We're going to move to this cerebral spinal fluid. It's a clear liquid, sort of yellowish in color. It's very rich in glucose, and that's important for you to remember when we talk about meningitis. And the purpose of the fluid is to cushion the brain. The fluid is produced in the choroid plexus of the ventricles, and it flows through the brain structures and around the spinal column. And then it gets reabsorbed by the arachnoid villi. So you need to remember this when we talk about hydrocephalus, when we talk about communicating versus non-communicating. So this is just another review of the CSF within the brain and its flow. Pathologically, what can go wrong? The most common things, meningitis and hydrocephalus. And that brings us back to the pressure-volume relationship. So we have our cerebral perfusion pressure, and then we also have our pressure-volume relationship. And this has to do with the CSF. We have a volume pressure curve, And it's a sharp increase in the intracranial pressure when the volume limits are reached. There's only so much room in our brains. But when we look at our babies, they have open fontanelles and sutures. So if they have an increase in the volume, what ends up happening is their head circumference is going to increase. The sutures are going to separate more, and the fontanelles are going to separate, and they're going to bulge. As this happens, it also causes a dilation of the superficial vessels that are on the scalp. So there is a balance of brain, CSF, and blood volume that is present to prevent us from developing an increase in intracranial pressure. So you can see on this picture where a space-occupying lesion will put pressure on the brain. So on the subdural hematoma, you see that the blood is below the dura. It's putting direct pressure on the brain on the left side, and as a result, it can push against that ventricle on the left side. And this is where you can see that steep increase. When we hit that point where there's no place else to go, our skull is not going to increase in size. So as the pressure goes up, it's going to go up very sharply. Now you should recognize this because it is a table that is in your book, and I suggest that you review what happens when there's increased intracranial pressure because of changes in the brain, the blood flow, or the CSF, because they can all increase the intracranial pressure. So our compensatory mechanisms, the autoregulation, increased cerebral blood flow with decreased oxygenation, and or the increase in the CO2 retention. And the pathology that can cause this is anything that can increase intracranial pressure that surpasses these protective mechanisms that we have in place. So your head trauma, your infections, your hydrocephalus. And so what we want to do is we balance the brain tissue, the CSF, as well as the blood volumes. And we'll talk about each of these as we go through the various neurologic disorders. And this ends part 1.